Hello and Assalamualaikum everyone. Welcome to our video assignment PhD 311. So in this video, we are going to share with you guys about satellite pharmacy department as well as our experience regarding 8 weeks of attachment in satellite pharmacy in Hospital Taiping. So let's go.
What is satellite pharmacy? A satellite pharmacy refers to a decentralized operating unit which has similar function with the central inpatient pharmacy. Satellite pharmacy provides specialized medication distribution services for hospitalized patients. The operation of satellite pharmacies relies on administration, staffing, and drug procurement from the main inpatient pharmacy department, and it usually do not offer direct services to the public. How many satellite pharmacies in Hospital Taiping? Usually, in large general hospitals, there might up 3 satellite pharmacies located in 3 different areas. It known as Central Satellite Pharmacy, Satellite Pharmacy A, and Satellite Pharmacy C. But in Hospital Taiping, there is only one satellite pharmacy. The advantages of satellite pharmacy are to reduce workload at the central inpatient unit, to reduce medication errors in drug supply to patients in ward during peak hours, to reduce storage at nursing facility, to improve drug inventory and achieve cost-effective operations, to dispense drugs to individual ward patients in effective and timely manner, expansion of pharmacy services, and increase physician and nursing certification. There are 3 pharmacy assistants in satellite pharmacy in the Hospital Taiping. They have their own role. For instance, pharmacists are responsible to manage the tablet section. Pharmacist B are responsible to manage the store. And pharmacist C are responsible to manage the patient discharge at the counter. What did the pharmacy assistant do in the satellite pharmacy every day? Pharmacy assistant do filling and supply medication to the inpatient and patient discharge. Pharmacy assistant also return the medication from the ward that the patient did not use.
Okay, so first we will talk about the type of drug available in satellite pharmacy. Okay, basically in satellite pharmacy, they have many group of drugs. For example, we have gastrointestinal group, cardiovascular group, analgesic group, vitamin, endocrine, psychiatric, and others. The drug is arranged by its group and alphabet. Hence, it is much more easier for the staff or for us to find the drug every day. Every group have different color tag, so it is much more easier to find the drug. Okay, next we will talk about how the environment in satellite pharmacy. Okay, in satellite pharmacy, we will usually busy at around afternoon because we have started to fill the drug in the trolley. And the discharge patient also taking their medication there, but not all of them, just certain amount of the patient. Okay, next I will put the sneak peek full of satellite pharmacy in Hospital Taiping. is the service of satellite pharmacy. The main service of satellite pharmacy is we refill the trolley for a certain ward in Hospital Taiping like ward 17, C4, C5 and etc. And satellite pharmacy also will prescribe the medication for patient because in satellite pharmacy we have a small counter for the pharmacist to dispense the medication to the patient itself. Okay, how we fill the drug? Based on what we refill the drug? We refill the trolley based on the charting that have been charted by the pharmacist itself. Pharmacist will chart the amount and the strength of the needed medication. If the pharmacist has error in charting, we can report it to PPF before we fill the medication in the trolley. Let's say patient need to take medication once daily, so the drug is put at 8 a.m. BD, which is twice daily, will be at 8 a.m., 8 p.m. TDS, which is 3 times daily, will be 8 a.m., 4 p.m., 10 p.m. If QID will be 12 p.m., 6 p.m., 12 p.m. and 6 a.m. That is for tablet. And for injection, OD will be 12 p.m., BD will be 12 p.m., 12 a.m., TDS will be 12 p.m., 8 p.m. and 4 a.m. and QID, the time is same with the tablets. Different hospital have different time the patient need to take medication. Furthermore, pharmacists also can reject the pink slip. Basically, we call the pink slip. It is like the order made by the prescriber, and if the pink slip is not completed, like no prescriber signature or no frequency, they can reject it, so we do not have to fill it. Did the satellite pharmacy do indent? Satellite pharmacy will indent if the medication is not in satellite pharmacy. They can indent from what supply substore or from logistic, which is the main substore in Hospital Taiping. There we use PHIS system to indent the needed item, and the substore will accept before they can issue the item. After the item has been issued, satellite pharmacy can collect the needed item. Okay, so basically that is what we need to know about satellite pharmacy in Hospital Taiping.
So next we are going to proceed with FIFO. What is FIFO stands? FIFO stands for first expired, first out. We usually use FIFO instead of FIFO in Hospital Taiping because sometimes there is a problem regarding the medications arrive at the sub-store. So we use, instead of using first in, first out, we use first expired, first out to ensure we given the latest expired first, and the late expired will be located at the back of the rack. So next, what is the PIN card? PIN card is a record card that usually we use to record the medications that is we given to the patients, and also we want to know the balance of the stocks. And next, it is usually we record for antibiotics and for antibiotics. Next, to proceed with what is the details needed to do the PHIS label. So when we do the label, we need the identification number of the patients, so that we will do the label and we will get the location and also the reference number of the patients. If the patient is not registered yet, we will register them as a new patient. Then if you guys have a question regarding did the satellite pharmacy did the floor stock, they unfortunately they don't do the floor stock because usually the floor stock is done by the ward supply. Next, we are going to proceed with what is the system used to check the drug low in stock. Usually, they will use a PHIS system so that they will know everything, the information is there because there is a drug the drug balance, and also they will indent from PHIS also. So next, last but not least, if you receive a dangerous drug in the pink slip, you should tell the pharmacy so that they will supply it to the patient, because as a pharmacy technician we will not supply it to the patient. So yeah.
Hello and hi guys, my name is Najmi. I'm a part 5 student of Diploma in Pharmacy UiTM Campus Batam. So in this video, I would like to share with you guys about my 2 months experience attachment in pharmacy satellite in Hospital Taiping. So first of all, our satellite pharmacy in Hospital Taiping only have just one department. So and it is located between the Ward D and Ward C building. So it has a 2 section. First section is for inpatient ward, and second section is for patient discharge. So in this video, I will share with you about my experience in inpatient ward section, and my friends Aiman will share with you about the section of patient discharge. Okay, let's go. Started our service at 8 am to 5 pm. Usually in 8 am, we quite not busy. However, we started to be busy at 10 am and afterwards. This is because most of the trolley usually arrive around 8:30 am to 9:30 am, except for ICU wards and geriatric wards. This ward usually arrive earlier, and others we have to wait first for the trolley from those ward to arrive before we started to fill the medication. So when the trolley arrive, what we need is we need to first sanitize the trolley by using 70% of alcohol spray, and then we record the time of the trolley arrive in a ward file. So basically in this file, it has a date and the time of the trolley arrive, list of fridge items, signature from pharmacist and nurse, and after that we check for the trolley for any return medication, and then we update the patient bed and we started to filling. So back in the filling process, basically in the filling form, we need to look at all the details in terms of the patient name, the patient beds, RN number, and for the drugs we need to look at the drug names, the drug strength, the quantity prescribed. So we need to look very carefully about all the details, because if all the informations are correct, we can start fill the medication in the trolley bin. So if there are any errors in form, for example wrong dosage strength or the wrong quantity of medication is given, so we need to recheck back with the pharmacist. So for huge amount of medicines, so we usually fill the medication in the box or a plastic bag, and we put a small label on it. Usually we need to finish filling up the trolley before 12 pm, as the nurse at that time was started to take back the trolley to give the medication for the patient in wards. As my experience here is such a wonderful experience that I've got in my 2 months being attached in this department. Here I learned a lot of in terms of the workflow of how we supply the drugs for patient in wards. So all the staff here, especially the pharmacists, the PRP, the PPF, are really helpful in teaching us, and they are really kind and heartwarming. So my advice, we work here as a PPF. First, we must be efficient in doing our work, especially the process of the filling the medication. We must always be careful in checking the strength, the dosage, the quantity we need to supply, because it becomes our duty to check to avoid any errors in the medication form or prescription. So it's a really huge responsibility for us to do it, because a single mistake can cause bad effects to patient itself. Second, do not be shy to ask if you do not know something. If you do not know some things like the locations of the drug or how to fill the drug in the trolley, just ask the PPF or the pharmacist. Do not make your own way. Don't worry, all of them are really kind and helpful. So just ask them politely and surely they can help you. My third advice is wear a comfy shoes. Working here is quite tiring. Hell tiring, I would say, because we started working here start at 8 a.m. to 5 p.m. and this department is the one of the busiest department of pharmacy in this hospital. So we need to always walking and standing, and we quite not have a chance to sit because our satellite pharmacy is quite small. So wearing a comfy shoes like a black sport shoes is really recommended as we work here, and it might not hurt your leg for long.
Hi everyone, today I want to share my experience of undergoing 2 months of practical training at Satellite Pharmacy. I would like to focus my experience on being at the Satellite Pharmacy at the discharge counter section of the Satellite Pharmacy. In case you didn't know, at Hospital Taiping Satellite Pharmacy, there is a discharge counter section for a patient who are discharged on the same day from a nearby ward to get their follow-up treatment after being discharged. This discharge counter supplies medicine in the unit of use, where we supply a medicine to the patient for at least 1 month after the patient is discharged. After that 1 month period, the patient need to take their next medicines at the Klinik Kesihatan Malaysia or at the hospital, as well as at the Pharmacy Klinik Pakar in Hospital Taiping, which has been made an appointment and confirmed by a doctor for a follow-up treatment. Discharge counter at the Hospital Taiping is open from 11 a.m. to 5 p.m. This counter opened a little bit late because the pharmacy staff prioritized the preparation of medicine, which is filling the trolley to provide the medicine to the patient in the ward. The pharmacy supplies of follow-up medication is based on the prescription received from a doctor handling that patient. After receiving the prescription, the pharmacist must ensure that prescription is complete with the patient name, patient registration number, medication and dose of the medication, and the most problematic is the doctor's stamp. Why did I say that? The most common case where the pharmacist has to reject the prescription is because there is no doctor's stamp. So the patient need to see the doctor again to get the stamp to complete their prescription. Once the prescription is complete and accepted by the pharmacist need to transcribe this prescription using PHIS, which is the pharmacist information system, to indent the medication needed by the patient. After the label is made, the pharmacist assistant, including myself, have to provide the necessary medication, which is the process of filling the medication according to the prescription received by the doctor. After the filling process is complete, filler need to sign the prescription and state the next appointment of the patient to receive their next follow-up medication. Once this process is complete, the pharmacist need to check the medication that has been prepared correctly according to the prescription so that it can be safely released to the patient. According to my experience at this discharge counter section, my advice is when filling the patient's medication, do not rely too much on the label made. See the prescription for more accurate medication information. This is because the label made is sometimes mistaken for a dose of medication that can cause a medication error. The other advice is don't be shy to ask a question because asking is the way of learning. That's all from me. Thank you.
So in the conclusion, I hope you guys can know what exactly is the pharmacy satellite is and how it works based on our video. We do hope that you can learn and know a little bit about the satellite pharmacy in Hospital Taiping. Working in the satellite pharmacy is such a wonderful experience for us. Although working in this department is quite tiring, so it's such a best experience working here. So thank you for all the viewers that watch this video. We hope you guys can enjoy the video, and for all of our juniors pharmacy out there, we wish you all the best.